today. Can I have your name? Have you state your name and your date of birth?
Wendy Vong, March 31st, 1987.
Okay, perfect. Do you happen to have any allergies at all?
Yes, I'm allergic to amoxicillin.
Alright, so I'm going to make note of that. Okay, so your doctor has ordered a wound care change, and I'll be taking care of that today. I understand that you already had your pain medication, so I should be setting in and hopefully don't feel too much pain. If there's any discomfort, please let me know.
Okay.
I will be making sure that you're comfortable. Set the bed in a more comfortable position for your patient. Also, make sure to provide pants for your patient. Right. So, make sure you have all your supplies. So I'm going to grab the box of gloves, so I'll be right back. Because those are very important. So I have that right here. Alright, so next off, you will be doing hand hygiene. So have that in there. Get it right in between your fingers, and then you'll be putting on your gloves. Stick those puppy on, and you are good to go. Alright, so when removing your dressing, make sure you stick your finger between the skin and the tape and make sure it comes off and not tear off the skin. So we have that. Alright, when pulling off the dressing, make sure to check for any drainage, for color, smell, odor, smell/odor, and make sure you throw that into the trash. Alright, next off, we'll be measuring the wound for length, width, and depth. So, I have my ruler, handy dandy ruler right here. So for the length, it is about 2.4 inches. So we'll write that down. And for width, it is approximately 2.2 inches. So I'll put that right there. Alright, so for the depth, you'll be using your cotton applicator, so make sure you remove that away from you. Grab one of these guys. And so you'll be undermining, checking for any tunneling.
My dad, do it again.
So I've noticed while undermining, there are two tunnels.
Do it again.
So when addressing those tunnels, you'll be using the o'clock system. So here we have one at 2 o'clock, and I will stick my cotton applicator in there, and approximately we measure in centimeters. 3.5 centimeters. Alright, so there's the second tunnel, which is around 9 o'clock. And that is about 2 centimeters, so I'll write that down. So we are done with measuring the wound, so you will put this into disposable garbage. So you will be removing your gloves and setting up your sterile field. Make sure when setting up your sterile field, remove any items that is unnecessary out of your way. So I will put this on the side because I do not need them. Alright, make sure everything's all set to go. And also have your tape ready. So I've got it set here. Make sure you have your the date written, the time, as well as your initials. So I have that set over here. Alright, I will remove the tray, opening it away from me. Also, I will be removing this sterile sheet and make sure it does not touch anything. So I'll grab it from the corners, take a step away, and have just drop. Voila. Alright, so we were setting that onto the table.
No? Then you're not in it.
Voila. Okay, so next off, you'll be dumping
So
everything
in
from
real
your
life,
sterile
mad.
packet onto your sterile field sheet. Ooh, yeah. So we'll put this aside. And you'll be using that for your saline. Also, remember when opening your saline solution, make sure to date and to date your saline because it's only good for 24 hours. And when pouring it, make sure you pour it away from the label.
Actually, I want to grab this.
That one.
Can you help move this
I
one?
date it and
I
I'm
wanna
pouring it
and then use
away from the label. So have that there. So next off, I will be putting on my sterile gloves. Very important here. So I have my sterile gloves right here, and I will be performing hand hygiene before putting on the sterile gloves. So got that going. All right. So I am left-handed, so it's also important to make sure that you know how to put on the sterile gloves. So I've opened it away from myself. This side. Alright, so I'll be opening my sterile gloves. Since I am left-handed, I will use my non-dominant hand, my right hand, to don on my gloves.
Found the medium.
Slide them in. Alright, and then I'll use this hand to
Do you know Melody?
grab this other glove and slip it on. Make sure to keep your sterile gloves sky high and in front of you to reduce any contamination. Alright. So next off you will be performing irrigation. So before that you will set up your station. So make sure it's all organized.
Gloves right anymore.
So it's easy
Life when you
to
can't even put on gloves.
grab all of your essential items.
If they are excessively
Also
steam,
have
have like a cloth. That looks good.
Make sure when you're opening your bag, you set it aside and you drop it. It's dropped. Dropped. Okay, so you will put some gauze into your sealant solution over here. That is all set. And so I will be irrigating the
She like made
glue.
it perfect.
So I'll grab some gauze, put it over my fingers. I have my saline solution to perform irrigation. So when irrigating,
Product now, it has to be
you'll be
amputated.
going from the top to bottom, and for any
No
excess
point putting in
saline
IV anymore. This is
and so forth, you'll be catching it underneath. So
No more need for IV line.
grabbing all the excess fluids. Alright, so the irrigation is done. This will be thrown into Sharp's container.
Found it. I found the one I
The
used
Sharp's
like
container is over here.
the
This is thrown into your biohazard bag, so you will drop it.
Oh, the needle.
Alright, so next off,
No.
you will be performing these gauze, or you'll be opening your gauze. So it is open, make sure that's set, and it's wet, so make sure to keep it away from your sterile field.
Those things.
Alright, so you can grab one
The
of your
forks.
forceps.
Oh, there's a fork.
Grabbing a forceps and a cotton swab applicator to help pack in the gauze. So when packing in, you want to pack in all directions. Make sure you also get the tunnels. So there's two here. So make sure to pack it in right in there.
No, we don't.
Make sure there's aren't any gauze sticking out where it's in. Just all in there.
Okay. I don't need this. I don't need
Alright,
this.
I got the other tunnel as well. Alright, I'm gonna grab another one. And I will do the same process all over again. And pack it in.
Fermented.
nice and packed inside. So afterwards, you'll be disposing this into the sharps container and into your biohazard bag. You drop them. Keep your hands up in front of you. Alright, so next off you'll grab some gauze to set over on top of your wound, packed wound there. And then next off you'll be putting
I don't know why
your
you used
pad.
to supply that.
Perfect.
I
At this
don't know
point you
why
can take off your sterile gloves and dispose of
Like,
them
what about the sticker? What happened
into
to
the biohazard bag. Drop.
use a sticker.
Alright,
Like this?
so next off you'll have your tape,
Uh-huh.
and it's already dated and
Well,
labeled.
I don't.
So you'll
and I
stick that
couldn't
on.
get the validation.
Because you need it for your validation. You do?
Make sure it's nicely set.
Really? Yeah. Well, you're supposed to use that to practice.
You're supposed to
Alright.
use those they provided.
The wound is addressed. Also make sure to make proper
Round two.
preparations of putting or disposing all of your materials away afterwards. So I will be putting this all into the biohazard bag, and that is the end of our wound care.